Good afternoon, everyone. Thank you so much for your patience. We had a little bit of technical difficulties getting things set up on Zoom here to get going this afternoon. Thank you for joining our COVID-19 media update here. We've got 3 presenters today. Dr. Rachel Herlihy, our state epidemiologist at CDPHE, Director Scott Bookman, COVID-19 incident commander at CDPHE, and Lieutenant Colonel Jamie Piper from the Colorado National Guard and senior advisor for COVID-19 response.
I haven't really.
All right, we're going to go ahead and get started. If everybody could mute themselves. We have a lot of background noise going on here. There we go. Okay. Well, with that, Rachel, let's go ahead and get it started.
All right, good afternoon, everyone. Want to provide you today an update on trends here in Colorado, compare our trends to US trends, and then talk a little bit about some of the variability that we're seeing both geographically here within Colorado and also by age group. All right, so starting here, this is a figure that shows us case trends here in Colorado in green compared to the US overall. So what you can see is that in the last couple of weeks, both in the US overall and here in Colorado, we have seen downward trends. So certainly seeing an improvement in overall rates when you look at the national picture and Colorado. But obviously there are differences in trends and variability, both within the US and then within Colorado as well. So next slide, please. So comparing Colorado to other states across the country, you see that we continue to do quite well. Our position here has gone up a little bit, meaning that we were previously within the last week or so a little bit lower here. Our rate was lower compared to other states. And so we've moved up a little bit here, primarily because the rates in some other states have started to fall faster than the rates are decreasing here in Colorado. But overall, we continue to have a very favorable position with our level of disease transmission here in Colorado compared to the rest of the country. If you look at the top of this figure, you'll see some of the states in the country right now that have the highest rates of transmission. Certainly Alaska is standing out right now, West Virginia, some northern states like Wyoming and Montana, North Dakota, Idaho. We're seeing transmission coming down in some of the southeastern states, but still pretty high rates of transmission in some of those states. Again, so lots of variability across the country. So while overall we're seeing a decline in US rates overall, that's certainly not the picture in all states in the country right now. Next slide, please. Similarly, we're seeing quite a bit of variability here in Colorado. So this is a map showing you county level rates across the state right now. Most of the counties in Colorado right now are seeing a decline in cases, but there are some exceptions and some counties where we continue to see high rates of disease transmission. So some of the counties where we're seeing higher rates of disease transmission right now include Moffat County, Grand County, Mesa. Some transmission is higher on the Eastern Plains, the San Luis Valley certainly standing out here. And that's a place now where we are seeing actually increasing rates where most of the state is seeing declining rates. Also some higher rates in the southwest part of the state. Next slide, please. And this is a figure that shows us what rates look like by age group across the state. So you'll see that there is quite a bit of variability. Did you get that email
from the school? Okay.
So you'll see that looking at age group comparisons, we see the highest rates continue to be among that 6 to 11 year age group. That is, again, our school age children that are not yet eligible for vaccination. We've seen a nice steady decline in rates of transmission among that 12 to 17-year-old population, where we're probably starting to see a clear benefit from vaccination in that age group. I showed some of that data last week. I'm also seeing a steady decline in our adult population overall in the state. For that 0 to 5-year-old population, that's our youngest population, we're seeing a little bit more of a flat trend there. So I mentioned we're seeing quite a bit of variability across the state as far as, geographic trends being different. We're also obviously seeing those differences in age groups. I do want to point out that we have seen a slight increase in transmission, once again, in that 6 to 11-year-old age group. That's just a couple days worth of data. So we're going to be watching that closely to see if that trend corrects itself and if we can see those rates go down in that age group like we're seeing in the rest of the age groups. But I think it's an important reminder to us that this overall trend and improvements that we're seeing in the state right now are fairly tenuous and pretty variable across age groups, across geography. in the state, and really all of the strategies that we've been using continue to be really important, especially as we move into the fall, which is a transition period. People are going to be changing behavior, moving indoors, and we know that that can potentially result in increased transmission as we move more into typical respiratory virus season. So again, keeping in mind that vaccination continues to be our best strategy to prevent transmission. Also keeping in mind masking indoors is important, and social distancing. And with that, I'll hand it over to Director.
Thank you, Dr. Hurley, and thank you all for joining today. I really want to kind of echo what Rachel talked about, which is while we are seeing a pretty steady decrease here now in our hospitalizations, we are still at an incredibly high rate of hospitalizations compared to where we want to be. And so while we are on the beginning of a downward trend here, we really need to see these hospitalizations go down significantly before we're going to feel comfortable with the hospital capacity that we have as we start going into the colder weather season and people start moving indoors. So as of today, we are at 829 people hospitalized with COVID in the state of Colorado, still a number that is very close to our peak during wave 1. And we're still working very closely with our hospitals to monitor their capacity. Next slide. So here you will see that downward trend, just between yesterday and today, dropping another significant amount of hospitalizations. We are starting to see that ICU bed utilization dip down a little bit. We do still hear from our hospitals, our healthcare systems, that they are seeing a lot of other hospitalizations for non-COVID. And so we do still see a high rate of utilization in both our ICU beds and our medical surgical beds. Continue to monitor our pediatric ICU beds, both for regular pediatric beds and then for our neonatal ICU beds as well. We have not seen a significant change in availability in those beds over the course of our monitoring. Next slide. And to stress once again, this continues to be a pandemic of the unvaccinated. As of today, 78% of those who are hospitalized with COVID are unvaccinated. This vaccine is free, it is safe, it is effective, it is widely available, and it is absolutely critical to ending this pandemic, preserving our healthcare capacity, allowing us to get back to the life that we love, the Colorado that we love. Next slide. And so yesterday, the Board of Health rule on vaccine mandate for healthcare workers went into effect. We are grateful to all of the organizations that worked with us and supported this Board of Health rule. It requires that all healthcare providers and people who work in these settings that have contact with patients have received their first dose of vaccine by yesterday. Our health facilities regulators today will begin the enforcement process. They will start collecting information from all of our regulated facilities to ensure that every healthcare worker has either been vaccinated or has a valid exemption as to why they are not vaccinated. And so that enforcement work begins today. This is another absolutely critical tool in keeping our healthcare capacity stable, ensuring that our healthcare workers are covered and that they are not out sick from work with COVID. We are also protecting the most vulnerable in their care to ensure that our healthcare workers are not transmitting COVID to any of their patients. And so we're grateful for the support and we look forward to working with all of our organizations to ensure that we move towards compliance rapidly. Next slide. And it is my pleasure to turn it over to Lieutenant Colonel Piper.
Thank you, Director Bookman. So since the beginning of the year, Colorado has worked really hard to ensure that COVID-19 vaccination shots are readily available. We currently have over 1,692 enrolled providers all over the state and in every county. And we have 4 community vaccination sites that we've increased their daily capacity for vaccine doses offered since the 20th of September. Our site at Dick's Sporting Goods Park in Commerce City will continue operating through the end of the day on Tuesday, the 5th of October. And our other 3 locations, one at the Aurora Municipal Center, one at the Southwest Plaza Mall in Littleton, and one at the Chapel Hills Mall in Colorado Springs, those will remain open past this weekend. So Colorado has over 76% of our eligible population who has received their first dose of the vaccine, and 76%, and over 70% of our eligible population is fully immunized. So if you're 12 years or older, you can get your first or second vaccination shot. And the third shot falls into the two categories you see on your screen before you. So you can get that additional dose if you are moderately or severely compromised with your immune system and you've already gotten a Pfizer or Moderna vaccine for your first two doses. And you can get a booster dose, and you should get a booster dose of Pfizer if you're 65 years old or older and you've already had Pfizer vaccine for your first two doses. If you live in a long-term care facility and you've had Pfizer for your first two doses. If you're 50 to 64 years old, you're at high risk of severe COVID and you've received Pfizer for your first two doses. You may get a booster dose of Pfizer if you're 18 to 49, you're at high risk for severe COVID, you've already gotten your first two Pfizer shots, or if you're 18 to 64 years old and you're at high risk because of where you live or work and you've already received your Pfizer vaccine for those first two doses. All of our vaccination sites in Colorado can administer a first, second, or third dose, and Coloradans can self-report their eligibility for an additional or booster dose. The great news that I'd like to emphasize is that Colorado has the resources and the infrastructure in place to continue offering vaccine to the unvaccinated to end this pandemic, while also distributing boosters. Next slide, please. We added an update to our website that shows where we show our state vaccination dashboard, and you'll see that box there on the far right. And that's going to show the number of fully vaccinated people who have received an additional dose. So as you can see, we already have over 124,000 people in Colorado who have gotten that third dose. That concludes today's presentation. Back to you, Brian.
Thank you, Dr. Hurley, Director Bookman, and Lieutenant Colonel Piper for that presentation. We're going to go ahead and open things up to a media Q&A. We'll use the raise hand function. If you have a question, please use that function and we'll call on everybody in the order that those questions were submitted. And we'll start with first questions first. If we have time towards the end here, we'll go ahead and get back to some follow-ups or second questions. Please do mention your name and the outlet you're from before you ask your question. And if there are any topics that weren't covered in today's avail or any questions that you can't get answered here in the Q&A, please do email us at media_info@state.co.us. And we'll go ahead and start things off by sending it over to Miranda.
Hi, this is Miranda with KKTV in the Springs. So we heard that the state health department was going to have healthcare facilities start reporting percentages of vaccinated staff twice per month starting today. So I just wanted to see if that information is going to be made available on the website or where we can get some of those numbers.
So this got, I'll take at least the first half of that question, which is yes, the Board of Health rule goes into effect, went into effect yesterday. And as of today, all healthcare organizations who are covered by this must begin reporting this information to us. They must report twice a month. It'll take us a little while to compile that information, and then we will find the best way in which to make it public.
All right, how about Sean Chitnis?
Hi, thanks so much. I just wanted to ask if any of you could react to the news we're hearing about this COVID pill and the option of eventually having an oral therapy, when you think we might be able to use that here in Colorado, and again, how you think that might help with our COVID response.
Yeah, this is Rachel. I can take that question. So certainly good news there. So I think you're referring to the new antiviral drug that Merck has completed trials on. They've submitted information to the FDA, and at this point, we're really anticipating what FDA's review might look like. Certainly hope that that could be a new important tool in our toolbox to fight the pandemic and keep individuals from developing severe illness. So again, I think at this point, we're learning more and looking forward to FDA's review.
All right, do we have any additional questions in the room? All right, well then we will keep things short and sweet today. Thank you, Dr. Herlihy, Director Bookman, and Lieutenant Colonel Jamie Piper. Thank you all for joining. And remember, if you have any questions that were not answered in today's avail, please email us at media_info@state.co.us and have a great weekend.